Cardiac imaging is a subspecialty of diagnostic radiology. A cardiac radiologist supervises or performs and then interprets medical images to diagnose diseases of the heart, such as arrhythmia, leaky heart valves, and defects in the size and the shape of the heart. In this presentation, we'll be talking about comparison and assessment of imaging modalities of cardiac imaging of three modalities: magnetic resonance imaging, MRI, cardiac computed tomography or cardiac CT, and myocardial perfusion imaging, MPI.
Cardiac MRI is a scanning modality that uses magnetic field and radio waves to take the detailed pictures of the heart and tissues. These signals are detected by a radio antenna and processed by a computer to create an image of the inside of the heart. The test will also help the doctors to find out if there's any heart abnormalities or heart diseases. It also identifies the damages to the heart from previous heart attacks and diagnosing any problems with the heart muscles, tumors, or birth defects. It also helps doctors to monitor how well a patient is doing with a treatment. Cardiac MRI does not involve the use of radiation. The magnetic field and radio waves used in cardiac MRI have no significant side effects, and they are not harmful to most people. However, in some cases, the patient should speak to their doctor before having an MRI if they have a pacemaker or any other implantable device, which the doctor can decide if the device is safe for the MRI. Second, if the patient is pregnant in her first 3 months, which the doctor would recommend avoiding the MRI unless the potential benefit outweighed the potential risk. Third, having an advanced kidney or liver disease, where the dye used during the exam can lead to a systemic fibrosis, which is a rare disease that causes a reduction of organ function and severe skin problems. As the cost of cardiac MRI in Australia varies between $100 to $500.
Cardiac CT has high sensitivity for detecting stenosis in native coronary arteries and can be used to reliably rule out disease in patients with low to intermediate pretext likelihood. It is also suited for detecting coronary artery bypass graft occlusion. However, in patients with stents, high rate of non-diagnostic studies and relatively poor positive predictive value limits the use of cardiac CT. Here is the assessment of cardiac CT imaging modalities for different aspects of the cardiac system. For CAC score, the benefit is the amount of calcium correlates well with total plaque burden CAD risk stratification in a symptomatic population. However, it is unable to identify non-calcified plaques, and it does not provide clear screen and treat intervention data. For CCTA, the benefits are the non-invasive evaluation of coronary anatomy and the high negative predictive value. The disadvantage is the absence of functional information. Furthermore, the cost of using cardiac CT in Australia is $250.
So I'm going to talk about myocardial perfusion imaging, MPI. To start off, let's have a better understanding of what perfusion means. Perfusion, in the biological sense, is the ability to deliver blood to the capillary. Now let's move on to myocardial perfusion imaging, MPI. MPI is a non-invasive imaging test that will show you how well the blood flows through your heart muscle by using heavy element radioisotopes such as thallium-201. It can show the area of the heart muscles that aren't getting enough blood flow, and it also can show you how well the heart muscle is pumping. This test is often referred to as nuclear stress test. In other words, this method used to assess myocardial perfusion, which allows us to identify the area of the low perfusion. The image below shows the example of MPI result. As you can see, the upper row shows the result of the heart muscle under stress, and the lower row is showing the result of the heart muscle under stress. Myocardial perfusion is used to test the patient with chest discomfort to see if the discomfort comes from the lack of the blood flowing to the heart muscle caused by the narrow or the blocked heart artery. Now let's move on to the cause. According to Australian family physician, in order to take the MPI test, it would cost around $4.49 to $8.34 per test.
The benefit of the three modalities differ, whereas MRI helps the doctor to diagnose a disease or injury, and it can monitor how well you are doing with the treatment. CT has high sensitivity for detecting stenosis in native coronary arteries. MPI is a test that is used to look for major blockages to the blood supply of the heart. The risk of the three modalities are: MRI cannot be used if the patient has a metal in their body, such as a pacemaker, because the strong static magnetic field will attract magnetic objects and may cause damage to the patient. CT scanning is in general not recommended for pregnant women. Also, there is a slight chance of cancer from excessive exposure to radiation. MPI has several side effects such as minor pain, bruising and/or infection from IV cannula site, and this may require treatment with antibiotics. Also, abdominal discomfort, heart attack, and mini stroke. The cost of the three modalities are vary. MPI is the most expensive, which costs around $3,600. MRI starts from $100 to $500, and CT scan costs around $250.